Hello everyone, this is Raymond Lee from Raymond's Dental Solutions. Today, I want to share with you how dentists can change lives in ways that medical doctors often can't. We've all heard it before. Medical doctors treat the whole body, while dentists only treat the mouth. This is common belief based on how medical and dental specialties are categorized. But when we look at it more closely, this simple division does not really capture the full picture of what each profession does, especially when we consider the real-world clinical practice and how patients experience care. Let's start by looking at what medical doctors actually do. Systemic reach. While some medical specialties like internal medicine or emergency care do involve treating the whole body, most MDs focus on specific areas. For example, ophthalmologists treat the eyes, dermatologists focus on the skin, and ENT specialists deal with the ears, nose, and throat. So in reality, the idea that MDs always have a broad whole body scopes does not always hold up. Continuity of care. Unlike dentists whose relationships with patients are long-term and ongoing, many MD-patient relationships are episodic. In other words, after a procedure or a short-term treatment, the connection often ends. This is especially true in specialties that don't require regular visits, like a surgery. Preventive role. While primary care doctors may focus on prevention, many parts of modern medicine are geared toward treating problems once they arise rather than preventing them from happening in the first place. This reactive approach limits the potential for MDs to have an ongoing impact on long-term health. It's an oversimplification to say that all MDs have direct, life-saving roles across the entire body. Their scope of influence is often more specialized and limited than we typically think. Now let's take a look at what makes dentists uniquely powerful, even though their focus is just on the mouth. Regular and ongoing relationships. Dentists usually see patients every 6 to 12 months for life. This creates a continuous cycle of trust and familiarity that deepens over time. Unlike other doctors, dentists have the privilege of regular contact with their patients, building stronger relationships that are built on consistency and care. Integrated psychosocial and physical impact. Dentists don't just treat physical pain. Issues like oral pain, chewing dysfunction, and even facial asymmetry affect more than just a person's body. They impact emotional health too. The way someone feels about their smile can affect their confidence, social interactions, and overall quality of life. Emotionally anchored trust. Dental visits often bring out feelings of fear or vulnerability. That's why the emotional connection between a dentist and a patient is so crucial. When patients trust their dentist, it's not just about fixing teeth. It's about creating a safe, caring environment where emotional bonds can form. Frontline role in preventive care. Dentists are on the front lines of the preventive care, detecting early signs of oral health issues like cavities and gum disease. But even more than that, dental professionals often notice systemic issues like heart disease or diabetes during routine exams. This makes dentists key players in identifying health problems before they escalate. While dentists work within the confines of the mouth, their impact reaches far beyond anatomy. Their role is holistic, influencing not just physical health but emotional and social well-being as well. Now let's compare the broader concept of MDs and dentists in terms of breadth versus depth of their impact. Anatomical scope. MD have a broad scope treating the entire body. Dentists focus on a narrow area, oral health. Frequency of contact. MD visits are often infrequent, episodic, and short-term. Dentists, however, have a regular, ongoing visit that build deeper, long-term relationships. Depth of impact. MDs primarily treat diseases. Dentists, on the other hand, provide a holistic impact, addressing pain, function, aesthetics, and even emotions, creating a much broader influence on a person's life. Contribution to satisfaction. While MDs are essential for health restoration and life-saving interventions, dentists improve a person's quality of life, helping them regain confidence and a sense of well-being. Continuity of care. MDs often work within hospital systems or practice-based models that don't always offer continuity. Dentists, however, create a private brand with ongoing relationships that can last a lifetime. So, when we look at the impact of dentists, it's clear that they often have a much greater impact on their patients than most MDs. By moving beyond narrow anatomical definitions and considering factors like quality, continuity, emotional connection, and the contribution to life satisfaction, we see that the influence of a dentist isn't just significant. It's often deeper, more lasting, and more personal than what most medical doctors can offer. Thank you so much for watching. Helping your business succeed is not just my goal, it's my passion.